Welcome to The Explainer. Today we're diving into something really important, the hidden signs of diabetic and blood emergencies. We're talking about symptoms that can look like one thing, but are actually something else entirely. And getting it wrong, well, that can have life or death consequences. So imagine this scenario. It's one that first responders see all the time. Someone's acting off. They're confused, maybe even aggressive. It's so easy to just jump to conclusions, right? But what if it's not what it looks like? What if it's a medical emergency that's totally treatable, but only if you know what you're looking for? That's what we're digging into today, these emergencies that can look a lot like intoxication. And we're going to start with the body's most basic fuel system. Okay, so before we can really get into what goes wrong, we first have to understand what right looks like. We need to talk about how our body, when it's working perfectly, maintains its energy balance. Think of it as the foundation for everything else we're about to cover. All right, let's break it down. Your brain really only needs two things to keep you going: oxygen and glucose. And glucose, that's the super important one we're talking about today. It's like high-octane fuel for every single cell in your body. But here's the catch. All that fuel is useless if you can't get it into the engine, right? And that's where insulin comes in. Insulin is the key. It's literally the key that unlocks the door to your cells. And it's this really elegant system, you know? When you eat something, your blood sugar, your glucose level, goes up. Your pancreas is like, hey, fuel's here, and it releases insulin. That insulin then goes and unlocks your cells, letting all that good sugar move out of your blood and into the cells where it can be used for energy right away or maybe saved for later. Once the blood sugar level goes back to normal, the whole system just chills out. It's a perfect balance. But what happens when that system breaks down? And that brings us to our first crisis. Let's stick with that fuel analogy. Imagine your bloodstream is just flooded with gasoline, but every single engine, every cell, has its fuel door locked shut. The gas can't get in. That's exactly what happens when you have way too much sugar in your blood. This condition has a name: hyperglycemia. And it's such a strange situation, isn't it? You've got tons of glucose floating around in the blood, but without enough insulin, without that key, the cells are literally starving to death while swimming in a sea of food. And all that unused sugar just keeps building up and building up, making the blood a pretty toxic place to be. So your body, it's not just going to sit there, right? It goes into overdrive trying to fix this mess. It tries to flush out all that extra sugar through your urine, which means you have to go to the bathroom a lot. That's the polyuria. All that peeing, of course, makes you super dehydrated and incredibly thirsty. That's polydipsia. And since your cells are screaming for energy, you feel ravenously hungry. That's polyphagia. You might even notice some other weird signs like deep, fast breathing or even a sweet, fruity smell in their breath. That's a sign the body's gotten so desperate it started burning fat for fuel, which creates these nasty acidic byproducts. Okay, so that's too much sugar. Now let's flip the script and look at the opposite problem. And honestly, this one can be even more dangerous, and it happens a whole lot faster. What happens when there's not enough fuel in the blood? This is what we call hypoglycemia, low blood sugar. And remember what we said the brain needs to survive? Glucose. When those levels get dangerously low, the brain is literally being starved of its only fuel source. The person's mental status can just plummet, and if it's not fixed and fixed fast, we're talking about permanent brain damage or even death. This is absolutely a time-critical emergency. And this right here is probably the single biggest clue to tell these two apart. It's all about how fast it happens. High blood sugar, hyperglycemia, that's a slow burn. It can take hours, sometimes even days to really develop. But low blood sugar, hypoglycemia, man, that can hit you like a ton of bricks. We're talking minutes. And the signs are totally different too. Remember how high blood sugar gives you warm, dry skin? Well, with low blood sugar, you're looking for the opposite: pale, cool, clammy skin. Their heart will be racing, and their whole personality can just flip in an instant. They can get anxious, super confused, even aggressive. And yeah, this is where it can look just like a stroke, or, you guessed it, like they're intoxicated. So this is a great little cheat sheet, putting everything side by side. Just look at those contrasts. Onset, slow versus fast. Skin, warm and dry versus pale and cool. Breathing, deep and sweet-smelling versus normal. It's like you're a detective, and these are the critical clues you need to solve the mystery and figure out what's really going on. And that brings us right back to where we started. This quote is drilled into every EMT and paramedic for a reason. It's so, so important. Never, ever just assume someone who's confused or acting weird is drunk. It could be something else entirely. A quick, simple finger stick to check their blood sugar can literally be the difference between life and death. You've got to rule out the medical stuff first, always. Okay, so we've talked a lot about the fuel, the sugar, in the blood. But that's not the only thing that can go wrong. Sometimes the crisis isn't about the fuel. It's about the vehicles that carry the oxygen and do the repairs. The blood cells themselves can rebel, and that leads to a whole other set of emergencies. So normally, your red blood cells are these nice, round, smooth little discs, kind of like donuts. They just zip right through your blood vessels, no problem. But in something called sickle cell disease, they get all warped into this rigid C shape, like a sickle. And these guys do not flow well. They get stuck, they clump together, and they basically create these microscopic traffic jams all over the body. And those blockages, they cause incredible pain and can damage organs by cutting off their oxygen supply. And then, on the complete other end of the spectrum, you have a problem that's not about blockages, but about the opposite, not being able to plug a leak. This is hemophilia. It's where your blood just doesn't have the right stuff to form a clot. For most of us, a small cut is no big deal, but for someone with hemophilia, even a minor injury, like a sprained ankle, can turn into a massive, life-threatening bleed because the body just can't stop it. So you see, whether it's how fast something happens, how someone's skin feels, or even the literal shape of a blood cell, all these little signs tell a huge story. And knowing what to look for isn't just for the pros, you know? It's knowledge that can help any of us be more aware, more prepared to help someone in a real crisis. So after all this, the real question is, what's the one clue that you're going to remember?